Zalfa Ahmed Juma tells her story whenever she can. It's about how she contracted the coronavirus. She wants to educate others about the dangers of COVID-19. She caught the virus last July here in Nairobi.
I suddenly had pains and didn't know why. And then I couldn't see. So I went to the hospital where they did a COVID-19 test. And they told me the results were positive.
She was put in a COVID-19 ward with 16 other patients. Only 4 survived. Zalfa was discharged after a month and could take care of Maqbul, her 10-year-old son, again.
He didn't hug me when I came home. He just said salam alaikum and sat down. He waited for his grandmother and then said, "Mom, I thought I was an orphan. But thank God I'm not. But now I'm having problems at school. When I cough, people say that my mother had the virus."
Zalfa and her family have now moved. Kibera, the neighborhood they come from, is Nairobi's largest slum. About 800,000 people live in this small area. There's little information about COVID-19, and it's often inaccurate or false. For example, that vaccinations make people infertile. Their old neighbors still avoid them, and only their one family respects them. It's been especially hard on Maqbul.
If you go to a store, the shopkeeper tells you that they don't have the items in stock that you want, even though I can see them there. At school, nobody wants to share a table with me. Even the teacher says that I should sit alone.
Maqbul and his mother think it might be better if he changes schools. They've already moved to the center of Nairobi, where no one knows them, and they're treated normally. Zalfa now has a small food service. She cooks at home and, in the evening, sells the food on the street. And she takes every opportunity to educate people about the virus.
I had COVID-19 and I was very sick. COVID-19 really exists.
And COVID is real.
She gets support from the Crisis Communication Chapter in Kibera. The CCC brings together journalists, government spokespersons, and civil society organizations. Zalfa's uncle, Mahmoud, had taken her to one of their meetings.
He told me the CCC is working to make people more aware of COVID-19.
Na huwa tuna deal na mambo na COVID, tunaelimisha watu through the awareness, sensitization.
They gave me advice and are also helping people in the community to slowly change their perception of the coronavirus.
So jamii wakaanza kubadilika pole pole.
The CCC trains Kibera residents to raise the awareness of others in their community about COVID-19. Zalfa is one of those residents. She has also been vaccinated. Maqbul is now working with the team as well, and through this, regaining his confidence.